Good day. How are you?
Friday.
I know. Happy Friday.
Indeed. Good afternoon, and thank you for joining us as we share the mandatory vaccination policy for all public service employees in core government departments, as well as agency boards and commissions. To further protect the health and safety of Newfoundlanders and Labradorians, our government is also introducing a regulation that will make COVID-19 vaccination mandatory for other groups of front-facing essential workers. People like personal care attendants, paramedics working for private companies, and early childhood educators. On behalf of Newfoundlanders and Labradorians, I cannot thank the dedicated members of our public service and those frontline workers enough. Facing immense challenges throughout the pandemic, you have continued to provide necessary services and programs to the people of our beautiful province. Navigating working from home with children cared for as well, you have never wavered in your commitment to providing the best service for Newfoundlanders and Labradorians. Thank you. By December 17th, 2021, all public service employees are required to be fully vaccinated against COVID-19 or have an approved medical exemption. This is not a decision that we made lightly. With the Delta wave hitting our province with a fourth wave, we are aiming for over 90% and beyond for those eligible to receive their vaccine. Our mandatory vaccination policy is another tool to make this a reality for Newfoundlanders and Labradorians. It's another tool to help people feel safe, because being fully vaccinated protects not just an individual, it protects all of us, our communities, and our province as a whole. I'm confident that our public service will continue to do their part to protect our friends, families, and co-workers. I'll now turn things over to Minister Cody as President of Treasury Board, who has done an exceptional job in navigating this mandatory vaccine policy. Minister Cody.
Thank you very much, Premier Furey. As we all know, COVID-19 is still within our province and creating difficulties and hardships for our families and our communities. Vaccinations are effective in helping to reduce the spread and severity of COVID-19. As Premier Furey said, the Government of Newfoundland and Labrador is introducing a mandatory vaccination policy. This policy applies to all public service employees in core government departments as well as Crown corporations. By December 17th, 2021, all public service employees are required to be fully vaccinated against COVID-19 or have an approved medical exemption in line with guidance from the College of Physicians and Surgeons of Newfoundland and Labrador. All new hires on or after December 17, 2021 are required to be fully vaccinated at the time of their employment start date. Government and Crown corporations will take the necessary steps to ensure the policy also extends to any vendor, supplier, contractor, or volunteer who regularly works alongside public service employees during normal business hours. We're implementing this policy in an effort to ensure continued safety in the workplace, as well as to provide additional health protection to all Newfoundlanders and Labradorians. On behalf of the Treasury Board Secretariat, I'd like to thank our public service unions and our Crown corporations for their input and advice discussions during the development of our mandatory vaccination policy. For those employees that are fully vaccinated, thank you for keeping your family, your friends, colleagues, and community safe. And if you are a public service employee and you are not yet fully vaccinated, please ensure you are on or before December 17th, 2021. Vaccinations work. Let's protect one another. I'll now ask Minister Haggie to give his remarks.
Thank you very much, Minister Cody. Just about the only constant throughout COVID-19 has been the need to change and adapt as latest science and new data come out. We're in the fourth wave, and we've seen evidence of that here, and we know our best defense is full vaccination. 2 doses provides the best protection. It significantly reduces the risk to yourself of getting the disease or getting a severe version of the disease. It protects you, it protects your family. Hospitalizations are much reduced, and it helps prevent the spread. Now, with the launch of the vaccine passport for the province, your ability, your choice as to what activities and what businesses you can access has also been affected beneficially by having the vaccination. But as government, we must continue to lead by example. And having heard about Minister Cody's actions, we will also be drawing up regulation to mandate COVID vaccinations for employers beyond the core public service. And this too will come into effect on December the 17th of this year. Some examples of places where employees and volunteers would need to have full vaccination would be things like personal care homes, private health clinics, regulated childcare, and fire departments. We're working to be in line with our federal and provincial counterparts across the country, stepping up, as the Premier said, to provide you with the tools to help each other help ourselves. The more people we have vaccinated, the better our barrier will be against COVID-19, and the nearer we will get and stay to our new normal. So again, thank you to all of those 90-odd% who have had 1 shot and the 82% who've had 2 shots. I would encourage anybody who's had only 1 shot to get a second, and anybody who's not got vaccinated to go and get the shot. Thank you very much, Premier.
Well, thank you, Minister. We'll now turn things over to the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 2 media in person and 4 joining by phone. There will be 2 rounds in the question and answer session, which will give each reporter the opportunity to ask 1 question and 1 follow-up per round. Our first question is from Patrick Butler, Radio Canada. Please go ahead and make your way to the mic.
Hello. So for talking about core government, but also these other employers who will be affected, for those employers that are not part of core government, who's going to decide who will have to, what are the consequences? Who's going to be deciding those? Are they going to have to follow them? And if businesses or if these other organizations don't follow them, are there penalties for those employers?
Probably best addressed to you, Minister.
Thank you very much for the question. We have said very clearly in this policy, this is for all public servants as well as Crown corporations, but any organization that has that works alongside of government, anyone, any contractor, anyone that really works day to day alongside of core government, any vendor, any supplier, even any volunteer who regularly works alongside of public sector employees, their employees will be required to be double vaccinated, to be vaccinated against COVID-19 on or before December 17th. So we will be speaking to all the, and the Crown corporations as well as core government will be speaking to any contractor, any vendor, any supplier, or any volunteer that works alongside the public service employees. They would have to be vaccinated, or they will not be able to participate in government activity.
We don't seem to have a clear number of precisely how many people aren't vaccinated at this point, be it in public service or in these other employees of these other employers that work with government. We've seen in Quebec this past week that government had to delay its implementation date for a mandatory vaccine. Is that going to happen here? Are we going to learn later on in the process just how many people this is actually going to affect?
We certainly don't hope so. I mean, We think that we've done good due diligence here and provided an ample timeline by introducing the VaxPass. We started socializing this through the media, through these channels, almost a month ago now. So people knew that this was coming, and we've given an extra long runway to get the vaccines that are required. But I mean, as the minister has said, and nothing is certain in this COVID-19 pandemic. Our intention isn't to change the deadline, but our intention was never to have a deadline to begin with. So, you know, we will adapt accordingly as the evidence and as the virus changes. But as it stands right now, that deadline is firm, and we've learned lessons, of course, from Quebec and other jurisdictions along the way.
Mark Quinn of CBC, please go ahead and make your way to the mic.
Thank you, and good morning. In the list of other organizations that we were given includes schools and post-secondary institutions. So if I understand correctly, does this mean that teachers will be required to be vaccinated by December 17th?
That's correct, yep.
Yeah, but yes, by December 17th, any public service will have to be, on or before December 17th, will have to be fully vaccinated, and that includes teachers and post-secondary institutions.
Okay. And as a follow-up, does this mean that if those people, those teachers at schools and post-secondary education institutions aren't vaccinated, that they'll be expected to take leave without pay?
Certainly, the policy does say that if you do not have a medical exemption, that would be the requirement. We'll look into the circumstances around that, but policy adherence is required, and we would expect that public servants would adhere to that policy, and we'll be working with our civil servants to ensure that they are.
Of course, there is in the policy the thought, and the good thought, I think, that every job is different, and there is an affordability for accommodation if one can exist. But certainly that's not the intent. The intent is for everyone to get vaccinated, and as the minister has so brilliantly navigated, this has been with consultation with the unions to ensure that this is the path that everyone was okay with.
Thank you.
Noah Shepard, VOCM, please go ahead.
Thank you. With healthcare worker shortages, how will it be possible to suspend any healthcare employees without pay if they are not abiding by the new policy?
Well, first of all, I think before I turn it over to Minister Cody, most importantly, it's our job as government to protect the citizens of this province in definitely turbulent times. And so if a healthcare worker is in a hospital exposing people who are vulnerable, immunocompromised to this virus, that's unacceptable, and we can't allow that to happen, and would arguably cause more destruction within the healthcare system itself than suspending someone without pay. So this has all been contemplated. We hope it's not a big problem. Certainly we're encouraging people to get vaccinated. The Vax Passport will help to that. But we can't have vulnerable people who often have no choice who they see in the healthcare system be exposed against, you know, when it's the basic substance of the harm principle that we're trying to capture here. But Minister, I don't know if you want to speak to the exact details of, you know, what happens after someone refuses to get a vaccine.
Thank you very much, Premier. We fully expect policy adherence. I've been, I think, quite clear on that. There are circumstances for medical exemption, and we will adhere to all legislative requirements as well. For example, anything under the Human Rights Act would have to be considered as well. But contravention of this policy, given the circumstances, could result. And may result in the employer asking the employee to be absent from the workplace without pay. Having said that, I fully expect our healthcare system is very strong. I know that the medical professionals understand how important it is to get vaccinated, and I would think that they'll be compliant with this as well.
Just to follow up, how will you ensure employers, specifically employers who may work very closely with their employees, will in fact enforce the policy?
Well, certainly, as I've said, anyone who works closely with a Crown corporation or with government, any contractor, any supplier, any vendor, any volunteer, who works closely hand in hand with the civil servants. They will be required to inform and ensure that all employees are fully vaccinated. And if they are not, they would not be able to continue on doing the work that they had been doing previously. So I would anticipate any contractor, any vendor, any supplier, any volunteer will ensure that they are fully vaxxed.
Peter Jackson, The Telegram, please go ahead.
Good afternoon. I'm curious, though, about private businesses. With the government, it's easy to implement a policy that its employees cannot continue working. What kind of penalties or enforcement will you be using for private businesses that decide they're simply not going to follow the policy?
Thank you again for the question. We are extending this policy to anyone. We also want to support our civil service, our public servants, and make sure they are protected as well. We want to make sure we have a very safe work environment, and therefore anyone who works alongside civil service, public service on a day-to-day basis, during normal business hours would be required to have that to be fully vaccinated. And as I said, that any contractor, if you're a contractor to government, if you're a supplier to government, we would expect for the business to ensure their employees that are having that connection and contact with public servants, that they would be fully vaccinated, and we will make sure that they are as they come into the workplace.
It's possible I didn't phrase my question. I'm talking about businesses that have nothing to do with public service, but serve vulnerable populations or must utilize the Vax Pass. These are apparently also required under the policy to be vaccinated. I'm wondering how will that be enforced for private businesses that have nothing to do with the public service?
Regulation.
Yeah, so we will be implementing a regulation to ensure it's enforced. As we work through that regulation in the next week or so, we'll provide updates about enforcement and penalties. But as it stands right now, we wanted to make sure everyone was fully aware. Sorry, I'm not looking at the camera because I'm talking to you on the speakers here. As we're looking, we wanted to make sure everyone was giving the best timeline that was afforded in order to reach that December 17th. So those details will become available over the next week or so.
Okay, thank you.
Dave Salter, NTV, please go ahead.
Hi, I just have a question about the testing requirements and what triggers those, because we were told in the briefing earlier that if you have medical exemption, you don't have to be vaccinated. So if those people that are medically exempt don't have to be tested, I guess sort of a two-parter. Why aren't they being tested, and what would trigger a test?
So I can deal with the medical side. First of all, that should be such a small percentage of Newfoundlanders and Labradorians that it shouldn't materially cause any outbreaks or impact any health services. The only reason, as I'm sure you're aware, to avoid a vaccine for medical purposes is an allergy to one of the components of the vaccine or pre-existing pericarditis or myocarditis secondary to the vaccine. So it's a slim percentage of the population that would even apply to. So that would not have a material substantive impact on vaccine rates or subsequent epidemiology consequently. But Minister?
Thank you. And as the Premier indicated, we're expecting an incredibly small number of people that would have either the medical exemption or based on exemptions under our legislative requirements, such as the Human Rights Act, that there'll be a very, very small number of people. But we wanted to be clear in the policy itself that what type of testing would be acceptable, and that is the PCR testing. And so we were clear in the policy what type of testing, but it would be a very, very slim number of people that may apply to. It could only be triggered if, for example, there is an exemption under some legislative requirement. Other than that, we're not expecting those types of tests to be required.
NAPE is having a meeting, or I should say a news conference after this. What's your take on how the unions will respond to this?
Certainly, I've had multiple discussions with all impacted unions, and we've had very thorough, and they've helped inform the policy. You can appreciate that, we wanted to ensure that we had those kinds of conversations. I think overall they're supportive of vaccinations. They would be informing I'm sure they'll be working with their members to help inform and encourage many people as possible to be vaccinated. And we've worked through the language and the policy and worked through, and they've advised us on some of that. So I think overall they'll be supportive of the vaccination requirements. They will be wanting to ensure that it is applied, that we do adhere to any requirements, legislative requirements, human rights requirements. They'll want to make sure of that. They'll want to make sure that people are treated fairly. And I think we've reached a good balance in our approach in this policy.
Thank you.
Emily Deming, All Newfoundland and Labrador. Please go ahead.
Thank you. For the businesses, specifically the private businesses where the NLVAX pass is required, would the employers need to enforce this for all employees or just those who physically work in the places where the pass is required, knowing that could apply to employees that work outside the province even but work for a business in Newfoundland where the Vax pass is required? Or if they have employees who, say, work at home. I understand you're still working on regulations, but generally.
Sure. Again, the intent is, as we've said many times throughout this news conference, but certainly there is built into the policy the ability to accommodate or afford opportunities for specific employees. For example, someone who can just work from a screen with no contact with the public, then arguably the employer could allow an exemption there. But that would obviously not every job is the same. We know that, and a lot of those, well, hopefully very minimal of those small number of exemptions would be worked out through the employer and the employee.
Do you have a follow-up question, Emily?
No, thank you.
We will now begin round two. And once again, reporters will have one question and one follow-up question. Patrick Butler of Radio Canada.
I'm curious about contingencies. This applies to teachers, nurses, paramedics. We know that these are fields where there is shortages in some cases. What are the contingencies in place if on December 17th, there is a significant number of people in any of these fields who aren't able to work anymore?
Well, thank you. An important question, because we do want to make sure that we have employees, and we do want to make sure that we have a robust numbers of employees being able to provide the service. I will say that I'm anticipating that that those in the healthcare professions in particular will understand the value of vaccinations, will understand what we're trying to achieve here in protecting not only a secure workforce and workplace and what I'm going to call safety in the workplace, but also protecting the larger population of Newfoundland and Labrador. So I'm anticipating that, especially as you've pointed out, in the healthcare field, they'll understand the value of being vaccinated, and for not only for themselves and their families, but for the safety of the workplace and the safety of Newfoundlanders and Labradorians. So I'm not anticipating the challenges that you have presented. But I will say that we want to encourage more people to enter into those fields, and we want to encourage, that they are a good workplace, a good healthy workplace, a good safe workplace, and we want to encourage people to enter into those fields.
Patrick, I would just add that when you're considering the question posed, you need to consider also the contingency that would be required should an infection get into the teaching system or into the hospital system. Our job is to protect as best we can, and this is a tool, this is a mechanism that will prevent the infection from getting into, just say, a nursing shift staff or an emergency department or a series of teachers in a staff room that would allow the outbreak to occur and then subsequently cause other stresses on the system. That said, we've been incredibly fortunate here in Newfoundlanders, as Newfoundlanders and Labradorians, in that, to echo Minister Cody's statements, our healthcare workers have stepped up time and time again. Our teachers have stepped up time and time again. Our frontline workers have time and time again. And we recognize that there are high numbers of vaccine and in those groups, and I'd like to thank them for their compliance to date. And what I'm hearing from those who have already got the vaccine, who are in those positions, is they want their positions further protected, knowing that their colleagues are also vaccinated.
Good point.
And just because we're all here, I'd like to ask a question about Muskrat Falls. This week we had a news of delays with the project. Is there a new date for finishing Muskrat Falls, and what does this mean for ongoing discussions on rate mitigation?
Well, the discussions are ongoing as we speak between all parties with respect to rate mitigation. The changing date, I don't think, will have a material impact on that. As per a new date, I hate to say date definitive or definitive date because it seems like none of them have been, and I'm wise to that. But certainly, we're working with Ms. Williams to see what the most recent update will be in terms of date of completion.
Mark Quinn of CBC, please go ahead.
Yes, we were expecting there would be an announcement today regarding mandate and vaccinations for government employees, but not, I think, the other organizations that have been listed as well. Why did you decide to extend it beyond government employees? And I guess as a second part, I'll ask my second question later.
Well, certainly anyone who works side by side, hand over hand with a government employee, any contractor that may be doing work in a building, any supplier or vendor or volunteer that's working, we want to ensure that safe workplace. And so we've included that, those individuals in this. And also we want to make sure, and I think this is for Dr. Haggie or Dr. Fury, we will be making a change to regulation to ensure personal care homes, for example, that may be privatized are also protected because, of course, the health implications of those, child care centers, for example. And so that regulation will be moving forward in the coming weeks.
Sure, and I think Minister Haggie has been rather silent, unusual for these conferences, Minister, but I don't know if you have a point to make here.
Yeah, certainly. Thank you, Premier. With regard to personal care homes and private healthcare facilities, by and large, our experience is that their vaccination rate for staff mirrors that of the community in which they live. One of the good things is that lately there is now no community in the province with the first dose rates below 80%, and those numbers are slowly climbing. Our aim really is not the stick as much as anything else. It's the carrot of relative normalcy with vaccination widely throughout the system, healthcare system, businesses, service industries in general. So really and honestly, from the point of view of private healthcare providers, again, the comments about protection of vulnerable individuals that hold in regional health authority facilities are just as equally applicable there.
And as a follow-up, I take from what's been said that we don't know exactly how many people may or may not be vaccinated who work for government or groups that work with government. But do we think that it mirrors the percentage in the general population, for example?
Yeah, certainly we do. I mean, we're lucky enough now to be over 90% with one dose. I think that's, again, a testament to how seriously Newfoundlanders and Labradorians have taken this. We have no reason to believe that there would be a maldistribution or skewed distribution different than the sample from government employees. We certainly know that healthcare employees, for example, and teachers have far greater than 90%, and that's again a testament to that group of hardworking women and men.
Noah Shepard of VOCM. Do you have any questions?
I do. Will any of these private businesses following the NL Vax Pass have to submit some form of record to government to prove all employees are fully vaccinated?
Well, certainly government, core government and crown corporations will be speaking with their contractors, will be looking to vendors and suppliers, any volunteers to ensure that they have, through the Newfoundland Vax Pass, that they meet the requirements of this policy. So they'll be have to come forward with their Vax Pass to ensure that, as they're working alongside of public servants, that they are, providing that safe workplace. So yes, they'll have to provide that documentation. With regard to the regulation, I'd leave that to Dr. Haggie.
Yes, certainly. Sorry, I was on mute. The issue around regulation is those are nearly done, and they will be released, and that information will be out there. There's an enforcement piece, and the Premier's already alluded to that at the moment, but this may fall through one of several mechanisms, and we have not yet finished the draft of which mechanism we would use, whether it's OH&S or what.
Thank you. If a person refuses and continually refuses to get vaccinated, will they be fired or laid off, such as I believe is outlined in the Ontario's version of this type of regulation, as that impacts benefits like EI?
Well, I won't speak to the federal system, but a contravention of this policy, given consideration to specific circumstances, will result in action by the employer, and may include being, having to be absent from work without pay. That is the end result. If we have someone who doesn't meet with any of the exemptions, who certainly just is not compliant with the policy that exists, and given any circumstances, they would be removed from the workplace without pay.
Thank you.
Peter Jackson at the Telegram. Do you have any questions?
Yes, I do. First, I'd like to clarify something that Minister Cody said back near the beginning. We were under the impression that there are only medical exemptions will be considered, but I believe you said that there is a possibility of a human rights situation that would arise. Can you explain what that would be?
With any policy, and thank you, Peter, for the question, but with any policy that government would have, we have to be adherent to legislative requirements. And I specifically mentioned, for example, the Human Rights Act. So we have to be under legislation. We have to be legislatively aware and understand the requirements under the Human Rights Act. So if, for example, there is an employee who feels that they have a case under the Human Rights Act, they would bring that forward to the appropriate authority and appropriate person within their workplace, and it would go through the normal mechanisms that any type of human rights case would move through within the workplace. So we do have legislative requirements that we have to meet, and this we have to provide that opportunity for that review.
Peter, I would just add that that's not different than any other policy that we bring in as a government. If people think their human rights are violated in the workplace, then there are mechanisms for them to use to resolve that and challenge it. And as the Minister said, that existed before this piece of policy, and will obviously exist well beyond this policy as well. So that's not something particularly specific to this policy.
Okay, thank you. And I'd also like to ask about the number of healthcare workers within the government system that are vaccinated. We recently got an exact report from Memorial University as to how many staff are vaccinated. Quebec has been able to provide an exact number of healthcare workers. Is there, at some point, are we going to get a percentage of healthcare workers who are and aren't vaccinated?
Certainly, I'll turn it over to Minister Haggie, but we believe it to be quite high. Part of the issue is self-identifying on the system, but go ahead, Minister.
Yeah, the short answer there, Peter, is yes. The Premier alluded to the fundamental issue there was that we use the self-identification mechanism for healthcare workers when they registered for their vaccine. So we will be in a position to do this. And in actual fact, I think the regulation and the mandate to the core government will actually clarify that extremely quickly.
Thank you.
Dave Salter with NTV, do you have any final questions?
Yeah, I have a question for the Premier. It's regarding Muskrat Falls. I know you answered one earlier there, but just want to clarify if you have any sense of how this delay is going to impact the cost of the project.
I wish I had a vaccine for Muskrat Falls, I can tell you that. I mean, we're still working through it. Obviously, when there are delays, there are financial impacts. And we are working with Ms. Williams to come up with how this materially impacts the bottom line of the project. As I understand it, they're not substantive delays, but again, I would never pretend to give an exact date or an exact quantum of the delay itself, because one thing is certain, that would seemingly be wrong. So we are moving towards a date completion, and as soon as we have an update and the material impacts of that with respect to the fiscal bottom line, I'll be sure to provide it.
Thank you, Premier.
And Emily Deming of All Newfoundland and Labrador, do you have any final questions?
Yes, this is a two-part, but real quick, just to clarify two of the phrases. For schools and post-secondary institutions, is that private and public schools?
Minister, I believe it is, but Minister, just confirm.
Yes, yeah, thank you, Premier. Yes, the short answer to the short question is yes.
Okay, thank you. And the other one is, it says that an appropriate healthcare provider is who you go to get a medical exemption. Who would that be other than a family doctor? So if you don't have a family doctor, where would you go for that?
A nurse practitioner.
Okay.
Thank you, everyone, for your time today. Premier, do you have any final comments?
Thank you all for joining us today. Believe me, there's none of us that wanted to be in this situation, but there's no one who wanted to deal with a pandemic either. The ministers and I have been working hard along with the core public service to provide the best service to you possible during these troubling times. And we believe that this mandate is the next step. Unfortunately, we're still working through the pandemic to allow you to continue your most normal life in a safe way. So thank you all for doing your part. We'll continue to do our part, and we'll work our way through it together. Thank you.
Thank you, Premier Fury. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
Well said. Excellent job to you. Very well said.